work for the NHS. You've had a great idea, you've made it happen, and it's made a big difference to how we can learn from COVID-19 and enter a new normal. Ideas like yours drive improvement and they deserve to be shared. That's what BOB does. Amplifying good ideas like yours across the NHS so as many people as possible can learn from, adapt and implement your idea. The further good ideas are shared by the BOB community who learn from them, the greater improvement we can achieve. You made a change. Share your solution with others. Speak to BOB.
Good morning, everybody. I'm here today talking to you from BOB.health. I'm Nic Vovk and I'm the quality manager. Until recently, I worked in the NHS and I can just really see the worth for needing somewhere for people to share their good practice and the how-to. So thank you for joining us this morning. This session is all about building confidence and sharing all the good ideas that you can then share with your NHS colleagues. And we've got a great range of speakers, so I'd just like to hand over straight to them so that they can introduce themselves to you. We'll start with Anu.
Good morning, everyone. My name's Anu Obaru. I'm a radiologist at St Mark's Hospital in London, and I'm really excited to be here with you today to share an impact story about an anti-racism presentation that I gave earlier this year.
Hi everybody, my name's Nikki. I'm an exercise physiologist with the cardiac rehab team at University Hospital of North Midlands. And myself and my colleague Sonya, we're sharing our story today about how our teams adapted during the COVID pandemic and how it's impacting on us and our patients.
Hello everyone, I'm Sonya Lockett and I'm the service lead for cardiac rehabilitation at the University Hospitals of North Midlands NHS Trust, and we're looking very much at how we've developed a virtual mode of delivery for our rehabilitation programme that was particularly important during the pandemic. So that was making use of video consultations and using our YouTube channel and social media platform to be able to provide that virtual programme for patients.
Morning, my name's Scarlett. I'm a final year medical student and I'm an intern for a project called Medic, which was founded by an NHS anaesthetist, Dr. Rachel Grimaldi. And Medic's a digital communication tool with an A to Z list of flashcards all related to patient care and management.
Hi, good morning, everybody. My name is Sami Nur. I worked in the NHS for about 15 years or so in various roles, from commissioning, program management, working at various provider level organizations to commissioning level services like STPs, ICSs, as well as national bodies like Department of Health, Public Health England. I am currently a digital health specialist, and I'm also Director of Strategic Development and Partnership at a company called Fibris.
Amazing. So as you can see, there's so many people talking from different kinds of projects, but what I'd really look at is the nuances between and why we all decided to share what we shared. So the first question that I'd like to put to you all is, what's your main call to action from your project?
Thanks, Nick. So I think for my particular project, I wanted to share some personal experience about racism and the way that impacts the experience of people of colour, and also how that impacts healthcare outcomes for our patients. And the precipitant was George Floyd's death in May, and followed, or kind of in the middle of the pandemic exploding, and the realization that certain communities were being more affected than others. I think what I wanted out of sharing my experience and some research that I did was to really encourage people to think more broadly about what it means to be Black or Asian or from an ethnic minority in our society, and how that affects our professional relationship with our medical colleagues, and also how we deliver healthcare. And so hopefully people will feel empowered and motivated to address some of those inequalities.
Amazing.
So for our project, we were a predominantly community-based cardiac rehab service, running clinics and exercise sessions from a variety of different places. So we operated from 2 hospital sites and largely community leisure centres, gyms, swimming pools and so on. So at the beginning of the pandemic, obviously these were ceased very quickly, and the ceasing of the face-to-face services at the hospital happened very quickly, and the same with the gyms and the closure of the leisure centres. So very quickly we had to adapt the way that we delivered our service in order to meet the needs of the patients. So quickly we sort of changed to a virtual model. We delivered sort of video clinics via Attend Anywhere with telephone clinics, and in the first few weeks and months of the pandemic we produced exercise videos, different series, podcasts and educational videos for our patients to try and deliver that service to them. Obviously our patient group were a high risk group, and they were the sort of group of patients that were really had a lot of questions at the beginning of the pandemic, and there was a lot of uncertainty. So for us the initial sort of call to action was the need of the patient, to be able to provide a service to them, especially when a lot of the other community services and GP services were sort of more difficult to access at that point. So we quickly partnered with a charity, Pumping Marvellous, a heart failure charity, to deliver live exercise sessions as well to their heart failure community, most of which were shielding at that time. And so it was really through the partnership with Pumping Marvellous that led us on to getting in touch with yourselves at BOB. I think I spoke to Chloe, and we shared our story of how our service had adapted during the pandemic, so that others could hopefully either learn or take some sort of notes from what we've done.
Perfect.
Yeah, and just to add on really from what Nikki has said there, I think definitely the driving force for the call to action for us was that sort of patient focus and the need to be able to support very vulnerable groups, especially considering some of their other appointments and routine follow-ups may not be happening in the same way. And I think as well alongside that was the fact that the commissioners very quickly came out in support of rehabilitation services for cardiovascular patient groups, knowing the effect that could have on readmission rates and the appropriate use of healthcare services. So I think that also helped to spur us on in terms of making sure that we had a delivery and a way to access patients, and making sure that our service was very visible to the trust and our wider community, and that we were still accepting referrals and delivering a service. And I think from my point of view, looking at it from a staff perspective as well, obviously this year has meant that we've needed to work very differently, and we've needed to work remotely, and a lot of our staff have been picking up new roles and responsibilities, particularly within their clinical caseload, and obviously it's more challenging then to offer that staff training and that clinical supervision and support that's needed when people are picking up those new roles. And I think platforms like Attend Anywhere and for our trust, Microsoft Teams, have been really useful to enable us to keep on with that MDT contact and that relevant level of support for our staff as well.
Definitely.
So Rachel, Dr. Grimaldi, had the idea of Card Medic after reading about a patient who described feeling very frightened on the intensive care unit when he wasn't able to understand what healthcare staff were trying to say to him through the PPE. And as a lot of us know, and many of us know, that wearing PPE removes people's ability to lip read. It takes away facial expressions and reduces clarity of the voice. So what's already a very scary experience for patients was being intensified due to this communication barrier. And what Card Medic provides is a free, very easily accessible platform with the range of flashcards that healthcare professionals can use to communicate more effectively with their patients. From being like a medical student, I've kind of had a step back and realised how the pandemic has exacerbated inequalities in healthcare. So in respect to communication, the PPE barrier has intensified challenges already faced in some groups, such as those with language barriers or communication difficulties. So CardMedic aims to improve patient care and experience, and also patient safety too.
I mean, from my side, excuse me, my main call to action for all my NHS colleagues and suppliers into the NHS is two things really: simplify and break the silos. So unfortunately, within the NHS, by design, we've had to kind of work within the various departments and organizations that we're affiliated with, but more often than not, there's so much crossover and cross-pollination that occurs, but sometimes we do unfortunately kind of get stuck into our little bubble and kind of view our work with blinkers on. My main call to action, and has been for a while now, has just been, work across the aisle, work along with all providers, commissioners, whether it's urgent care, primary care, mental health, work with the different suppliers and organizations that are delivering work in the NHS, and try and think about services from the perspective of a patient, which I'll talk about a little bit later. But it's our job, speaking from an NHS perspective, and anyone delivering services into the NHS, has to be the patient, and putting the patient's needs first and thinking about how they're receiving the information that you're sharing. And we can talk about that a little bit later.
Perfect. Thank you ever so much, guys. And like we're saying, it's that commonality of we want to make things better for our patients, and the best way that we can do that is by just aligning our work and making sure that we're sharing what we know. So really, on the back of that, what I'd like to put forward is ask you, what's your best experience of sharing?
Thanks, Nick. I think my project or my topic is one that's so emotive and contentious, and can be really awkward or difficult or uncomfortable to talk about. And so when I decided to present, I wasn't really sure what the reception was going to be. I didn't really know what people would think. I was speaking, I guess, from a place of pain and vulnerability about what was happening around me, and really didn't have any idea of how that would be received by anyone of any race. And so so there was this kind of anticipation or concern, and then once the talk was delivered and done, the feedback has been overwhelming. And I think for me, the best thing that has come out of that is hearing people say that they have a different kind of understanding or a different type of appreciation for some of the challenges that we're facing, and on a really personal level, people feeling motivated or convicted to be proactive about being anti-racist, and to speak out and to challenge structures within their departments or within their kids' schools, or, not just kind of limited to within the NHS sphere, but recognizing that we can have influence in all of the areas of our lives. And that's far greater a response or impact than I could have ever imagined. So I think for me that's kind of made the pain of sharing and stepping out worth it.
Absolutely.
So for myself, it's really just recognition of the work that we've done from other teams, from other departments, alongside patients as well. So it's kind of reassuring to know that the work that we've put in and all the hard work that we've done has not gone unnoticed, really. And I think sometimes within the NHS and within cardiac rehab, there are barriers to sharing information. And I think that can come from, your sort of information governance side of things, your trust side of things, but also I think sometimes people can be quite protective of their own ideas and not necessarily want to always sort of put that out there. And I think often with a lot of the sort of big conferences and talks and things, people, if you're in the sort of the right group, your stories get shared, whereas often, you know, if you're not necessarily within that group, your stories can sort of get missed. And so I think for ourselves, sharing our story and sharing what we'd done during the pandemic, the fact that we had so many other teams come to us to ask how we'd done things and how we'd initiated and set up certain things made it really sort of worthwhile to know that actually we have helped not only the patients, but other staff and people from a broader background as well. And I think for myself, really, for me, it's just sort of day-to-day run-of-the-mill kind of things, really. You know, it was needed at the time for us to create this virtual service to provide that for the patient, but actually in me thinking that it's just a sort of everyday kind of simple story, and it sort of brought it home to me that actually sometimes that's not so simple to them. They needed just that little bit of extra help to work out how to go about and do things. We had teams contact us from Canada, from Malaysia, from various places in the UK to ask how we'd set our services up. So that was really reassuring. And also the fact that we partnered with Pumping Marvellous meant that we could reach out to a whole range of the heart failure community. You know, they have tens of thousands of followers in their community. So that was really good that we could get that recognition from them as well. So it's been really useful, like I say, to share with other members of our cardiac rehab community as well, and get that sort of recognition and reassurance from them.
Great stuff. Now,
yeah, I totally agree with Nikki's points there in terms of that visibility and that transparency that we've had, especially with sharing our content on public channels like YouTube and with our social media pages. It's given a place for other services to be able to see the work that we're doing and be able to contact us and be able to use our resources, which I think has been really important, that sharing element, particularly during a pandemic where people were really just finding their feet and trying to deliver those essential services in the best way that they could, and the challenges that came with that, and the fact that we needed to use that digital model, certainly during lockdown. So I think for us as well, realising that a lot of that content doesn't just benefit the cardiac rehabilitation communities, and that actually some of that contact has been from those wider rehabilitation services, things like respiratory and elderly care, and also our musculoskeletal outpatients and therapies departments that may not have been in a position to be able to produce that material, but it's actually really beneficial for their patient groups. So I think that's been a really good experience for us of sharing our resources and content. And I think the COVID pandemic in general has made the NHS more willing to share and look broader and look at how we can support other specialities. And I think probably for me that visibility on the social media platforms also allows the Trust and the commissioners to see the work that we're doing. And I think it shows that we're very willing to work in new ways and adopt new ways of practice. And I think that then gives you more opportunities, and you find that more good opportunities come your way. So for us, what started out as a digital platform and making use of video clinics and the YouTube channel and social media, quickly with the commissioners realising the work we were doing, then give us the opportunity to make use of an online patient platform, so a patient library, which is BOB.health, which has helped to improve that service delivery, and also for our face-to-face work, being able to have funding for fitness tracker watches, so that we're able to provide that remote monitoring for patients. And I think all those other opportunities and funding pots have come from the fact that people could see the service that we were delivering, and that we were still very much operational for our patients.
Thanks, Sonya.
So I think my best experience of sharing was right at the beginning of the pandemic, where I was able to help as part of the pilot evaluation of CardMedic. And this was the best experience because it gave us a good initial idea of how it was helping patients. So we asked for 10 volunteers, and we, wearing level 3 PPE, asked these volunteers the same questions with the CardMedic flashcards and without the flashcards, just to see if it improved their patient, the understanding they had, which it did. And as a medical student, this was quite a new, exciting experience, and I learned a lot doing it. It's also taught me how it's important about how you use any innovation to get the best out of it. For example, like basic things, like we laminated the flashcards and the light was shining on the flashcard, which limited the patient's ability to actually read the words. So just small things like that actually make a really huge difference to how it's best put into practice. And when appropriate, I also share CardMedic with other students and other healthcare professionals on placement. And I think it's also, for students, it's really beneficial from an educational perspective as well, in that the flashcards are written in language that is appropriate and easily understandable, avoiding that medical jargon, and therefore improving communication skills for students.
So one of my fondest experiences of sharing was probably maybe tail end of 2017, beginning of 2018, when we were embarking on the online consultations program of work, which is essentially the ability to kind of enter the primary care or your GP practice through a digital entry point initially. I was leading on that work in Southwest London STP, and we were off, writing procurement specifications, and looked over, and my urgent care colleagues were leading on something called 111 online, which again was an online entry point into the urgent care pathway. I sat down with our teams collectively and said, look, we're basically doing the same thing, one from a primary care perspective, one from urgent care. It shouldn't really be for all the patient to decide whether or not their service is urgent or primary care, but it should be for us as the NHS to navigate that and to push them through whatever services and system we determine they need to go through. So we set up a joint working panel along primary and urgent care, and we wrote a specification that met the needs of both, and we went off and started the procurement process for a single entry point into from a digital perspective into the NHS in our patch. I delivered that procurement and that program of work, and then following that specification procurement that we did, that was then shared by the procurement hub, to give props where it's due, the DPS procurement hub across the country, as what they deemed the gold standard of procuring digital services, and it became like the embryonic template for what is now Digital First, which is a national program of work, but essentially kind of working across colleagues that sometimes might be sitting 2 tables away from you in the NHS, pre-pandemic obviously, when we're all working from home, kind of making sure that our work is aligned and simplifying the message for patients, because I think a lot of the time it's quite easy to work in our silos and not really think about how the message is being received out there in the real world. So yeah, I think that's one of the things that I'm quite fond of.
That's great, Sami. And it's the running theme throughout is it's just about making things simplified for our patients, but also for accessibility for patients as well. It's so key. So I just wanted to ask from that, what do you feel that enabled you to share well? And I'd really like to just really focus in on who or what gave you the confidence to do so.
Thanks. I think I didn't know how I was going to share. I didn't know who I was going to talk to, and I took an opportunity to ask the dean of our academic institute, which is part of our hospital, if I could speak at a grand round. And our grand rounds are usually reserved for clinical discussions. We have internal and external speakers that come and speak on a Friday morning, and I essentially volunteered to say, can I use that forum to share some stuff? And she was really instrumental in providing me giving me permission to talk to our professional audience, and also creating a safe space really where I felt comfortable to share honestly and openly, and I think without her support and the wider support of the chief exec of our hospital, which is part of a much bigger trust, and also them really publicising the talk and highlighting that yes, this is a departure from our normal content, but it's really important that as many of you attend. I certainly wouldn't have had the confidence to go through with it, and I think both of them together created a forum that allowed me to communicate with my colleagues, and then for us to also have open up some dialogue and have great Q&A, and out of that have spun many other conversations, and the ripple effect has been huge. So my gratitude goes to both of them for allowing me that access and then for supporting me through that process.
Amazing.
So for our project, predominantly being the sort of video side of things, video production for exercise videos, education videos and podcasts and so on, there's a few people really, I would say obviously Sonya, she sort of enabled me to take that upon myself to get those videos and things produced. We'd always had the idea that we would go into more of a virtual cardiac rehab model. There'd always been talk about that pre-pandemic, but obviously COVID sort of hurried that along somewhat, and so we, in the first few weeks, like I say, we were really busy at producing all of this sort of virtual content for our patients. So definitely the fact that Sonya and the trust, the people above her, the directorate, that they had the trust in us to produce these and to do this for our patients, that really enabled us to do it. But also the rest of the team as well, they all helped in producing these videos, all got involved. People who perhaps initially wouldn't be their first idea of fun really, but actually everybody's got involved and really helped out with that. So various different people really, and in terms of sharing the story and sharing what we've done and how we've done it, I would say again, yourselves at BOB, you've really helped out with that in sort of spreading that to a wider audience, and the same with the Pumping Marvellous charity as well, in sort of allowing our story to be told to a whole broader range of people that it wouldn't have been beforehand. So yeah, various different people, and I think it's all really helped, like I say, in spreading that information for us that actually has helped then other teams as well.
Cool.
Yeah, I think there's probably lots of small enablers along the way that then add up into a big effect in terms of that sharing and the project delivery. I think definitely the team and the ability and the skill set within the team to be able to deliver on those targets. And I think as well, COVID-19 in a way, I think acted like an enabler in that it did sort of temporarily put that pause button on the service and allow us to think in a slightly different way and consider new ways of working that we might not have done before. And I think it also acted as an enabler for our patient group as well. I think in general for rehabilitation and long-term conditions and certainly elderly patient groups, there is a feeling in healthcare that they may not be people that would engage with technology and digital platforms, which has caused a hesitancy in the adoption of that, I think, in healthcare for some groups. And I think what COVID did was enable everybody to get more comfortable with using technology and using the devices, and if they were using that to interact with family and friends, then actually it wasn't too much of a stretch to then use that in terms of healthcare appointments and delivery as well, which I think really enabled our service delivery. And definitely platforms as such as yourself to provide a place for people to see the work that's been done and have that how-to in terms of the approach that people can take. But yeah, I think there's definitely lots of small enablers that I think then add up to a big effect for you along the way.
That's a really interesting point.
I think as a student, it can be quite daunting to speak up when you have a suggestion or idea, and tricky to gain the confidence to do that. I think prior to working with Rachel on CardMedic, I don't think I've had the confidence to suggest CardMedic as I have on placement. Where I've seen patients where communication's been difficult, I felt able to share CardMedic with the clinical team, and having used it myself in clinical practice, have had some really helpful feedback from patients, emphasising how much it's improved their understanding about their care. A group that's definitely had a large part in me feeling able to share CardMedic is a group of speech and language therapists and learning disability nurses who have been working with since May time to create accessible versions of all the flashcards using simple English and symbols. And I've learned a lot about communication from this group, all of which I'll definitely take with me throughout my career. I think the person who's definitely given me the most confidence, though, is Rachel herself, who founded CardMedic. I've been very lucky to have this opportunity, and she's given me the confidence to learn lots of new, albeit initially very scary, new skills and use CardMedic on placement too.
Amazing.
So I think in my career, there's probably been a few individuals that have definitely encouraged sharing and empowered, those around them to be a bit more kind of free thinking and thinking outside the box in their approach. The entities that have probably really kind of accelerated this for me have been some of those organizations that are outside of your specific area of work. So mainly things like academic health science networks. Some of the Royal Colleges have been incredibly helpful in just kind of understanding what it is that you're doing in your local area or nationally or wherever, and then taking that and putting it into something that's quite accessible to anybody and everyone to kind of view. I think that's been a really, really useful kind of resource. I think across the NHS, we have so many incredible organizations and individuals that it's quite easy to kind of get lost amongst the 1.8 million employees of the NHS or the various different trusts and practices and you name it. But there are wonderful things and services out there. Just kind of finding them is sometimes the difficulty, and getting a platform that has, or having a platform or a space that you can go to just to kind of get ideas or find people that maybe are doing something similar to what you're doing or thinking about doing is probably the challenge.
Absolutely. Thank you so much, guys. And it just leads on really well to the next question, which is sort of like you've all got some great projects that you've been working on, and that you're saying you've got lots of questions that you've been asked and so forth. And just wanted to ask you, do you feel that having a how-to guide offers a real benefit for yourselves and also for your audience to be able to use as reference points to look into what projects you've been doing and potentially try to replicate where they work?
So the short answer is yes, absolutely, 100%. I think whenever you embark on something new or innovative or different, often you can kind of just be muddling your way through and kind of pulling things together. And it's only when you look back on your process that you can really kind of understand with clarity what you did and why. And I think for the individual or for the team, that retrospective reflection is so valuable because in the moment it can be really difficult to kind of take stock of that. But looking back, I think it provides invaluable insights. And I think what I've really benefited from writing my process or impact story for Bob is being able to capture all of those kind of different thoughts, different intentions, all the different resources, the decisions that I kind of made that I didn't even really consider how I was making, and kind of refining that into like a piece of reflective work or an impact story has meant that for all the people that said, how did you do it? Where did you do it? Where did you read this? What did you do? How did you pull together? Where was the data from? Now there's something that I can kind of point to be like, look, all the answers are here. If you want to do something similar, this was my process. These are the things that maybe I shouldn't have done, that I wish that I didn't do, or that I would do differently. And I think that's so valuable for the team or for the individual. It has been for me, but also it means that the positive impact that the project has had can be replicated elsewhere by other people that want to do it. And what's really nice about Bob is that applies to something like the project I did, which is so different from everybody else, but those principles still apply and still can be used, and you get the advantage of that.
Amazing.
Yeah, I completely agree with everything that Anu said there, really. I think looking back, when you've written particularly an impact story, looking back on your own work is really good for sort of self-assurance, to realise actually that, you know, you've perhaps done more than you think you've done. You know, quite agree that when you're in the midst of doing something or changing a process, you know, you just go along with it, and actually sometimes you don't always give yourself the credit that you deserve for those sort of things. So I think in that respect, from a personal point of view, definitely, and from our point of view for sort of sharing and disseminating information to other teams, absolutely. You know, we've had, like I say, we've had so many teams contact us from the UK, from different countries, to just ask how we've rolled out our virtual service. And like I sort of said, for me, it was really a sort of just, you know, a day-to-day kind of run-of-the-mill, you know, this is what we had to do. And although it was something that I thought was potentially, you know, quite straightforward, it soon became apparent that other teams were having difficulties in setting these things up. So, you know, we've had a really good social media following for many years now, and a really active Facebook page and sort of closed groups and things. And so that's something I suppose that we sort of take for granted a little bit. And actually our trust have been really supportive in allowing us to set these things up. The trust itself are very active over social media, and so that's given us obviously the support and confidence to do it ourselves, whereas other trusts don't always have that. And so, you know, over the space of the lockdown, we've set up video conferences, video calls, telephone calls with various different teams, just to chat them through these things. And I think, yeah, if it's sort of written down as a bit of a guide or as an impact story, it gives other people and other teams, you know, somewhere that they can go to find out that information quite quickly, and just helps them out with things that may be big or small, that ultimately, again, as we've all said, are going to lead to helping the patient.
Great stuff. Thanks, Nick.
Yeah, and I think in healthcare, we tend to look at our practice guidelines and information for innovation from conferences. And I think what tends to happen with that is they tend to give you what you should be doing and why you should be doing it, and what are the outcomes you can expect through that. But they don't necessarily drill down into that how-to. And I think that then can make some of those things feel quite idealistic and unachievable sometimes, whereas having that more practical guide and the real how-to written by a clinician who's actually introduced that pathway, I think can make those targets feel a lot more realistic then, which I think is really important in healthcare as well. And I think what's happened this year is that a lot of practice has been happening in advance of the guidelines, because everybody has been adapting to provide those essential services in very different ways. All of that innovative practice has meant that it's actually working in advance of those guidelines, so some of that data isn't yet available, and again, I think that's where the how-to guide and having that central point and that central hub for clinicians to be able to access that content and to see how people have been able to run those services throughout this is really beneficial as well.
Perfect.
I think definitely I agree with Anu, Nicola and Sonya. I think there's lots of aspects to CardMedic that people can use dependent on their own and their patients' needs, such as using the flashcards themselves, the different languages available, the ability to write your own words, to change the font, or read aloud function, all of which try to capture in the BOB impact story. And I think it's such a great platform to be able to demonstrate that and to help people to use it. I think one of the most important aspects of the how-to for CardMedic is the importance of assessing your patient's communication needs prior to using the CardMedic, or even not using CardMedic, which is something I've learned and I try and do now. Even, for example, do they normally wear glasses, and are these within reach? Hearing aids, do they have any difficulty communicating with aphasia? And I think that's even more important to recognise when using CardMedic to get the best out of the tool. I think it's also, I'd just like to say at this point, it's really helpful that we're really open to hearing any feedback for improvement or anything that worked well or didn't work well. So if anyone does have anywhere they've used CardMedic where they work, we'd love to hear anything.
Yeah, so in short, yes. I completely agree with everything everybody said. Probably I'm far more articulate than I am. But from a commissioning perspective, I think, you know, just putting things into perspective, like when you're embarking especially from a transformational perspective and transformational programs perspective in commissioning, when embarking on a new program of work, it's, you know, the amount of effort that's required to do research and kind of get an understanding of the lay of the land, and understanding how to go about kind of getting the funding from national, and then writing the specification and getting it out there and getting all the stakeholders on board is very laborious, and it takes a lot of time. And I think having that how-to guide would have been so helpful for me in my career, and probably saved not just a lot of time but a lot of resource that we could have then used elsewhere and delivered that transformational change in a much more efficient and faster way that would have ultimately benefited the patients and the local health economy. So yeah, absolutely. And I think a lot of people are kind of doing this out of their own, you know, goodwill and wanting to share with their colleagues, but it's not, from my perspective, it's not consistent enough, and it's not embedded within the way that we work in the NHS to the point that it should be the how-to do anything. You go to a how-to guide. If someone else has done it before, you know, don't recreate the wheel, kind of take what they've done, improve on it if you need to, tweak it and tailor it to your own personal needs, but don't recreate the wheel if it's been done before. And I think that's something that we spend a lot of time, unfortunately, doing, because we don't have those platforms readily available. I mean, now we do, thanks to Bob, but we don't have enough of that out there to make it kind of standard practice within the NHS.
This is it, isn't it? It's all bringing everything back around to our same ultimate goals. We want to be able to help our colleagues, help our patients, and make everything just much more succinct. And it's, you know, it helps the patient benefit, time, our own reflective personal growth, and so many different reasons. So the last question that we've got for the session is there anything that you would do differently now that you'd recommend your audience takes into consideration?
I think with regards to my presentation specifically, there is a couple of questions that I asked in the kind of pre-presentation survey that I would adjust, which I talk about in my Bob impact story, so you should go read that. But I think in general, I think I probably would have written up my impact story earlier if I had known about Bob. And so I think really what we can all do is try and amplify the message of Bob, because I think it's so useful. And I think when you just launch a new thing, that kind of increased appetite in that moment is kind of fertile ground for you sharing the impact story, so that you can amplify the message as, you know, as close to your point of impact as possible.
Thank you, Annie.
So for our virtual work and our the way we adapted the service, at the risk of probably sounding a little bit arrogant, I would say I wouldn't initially change anything that we did. I think we did really well at the time to work with the resources that we had to produce a service that was necessary for the patients, and a service that the patients found incredibly beneficial at the time. Of course, you know, I could be critical of the smaller points for the videos that I produced. You know, I may have said something slightly differently, or I may have produced it slightly differently. But on the whole, I think as a team, we came together really well, very quickly, in order to produce that service that was necessary. I think, you know, we rolled out the virtual clinics and the videos and the podcasts. We rolled them out very quickly, and actually much quicker than some teams had done, and actually much quicker than the guidelines that came out afterwards. So I think, yes, we did really well with that. And I think, you know, now obviously we're hoping to get back to more face-to-face appointments and sessions and so on, but that doesn't mean that all of the work that we've done is going to fall by the wayside. It just means that this is now going to be an adjunct to the other sort of services that we offer to our patients. And I think that's a really positive thing to take from, you know, the changes that everybody's made during the pandemic, that actually, you know, it's perhaps pushed people to do things that they may not have done beforehand, and things that have benefited certain patients that may not have done beforehand. And I think it's important to take all of those sort of positives and add them on as well. I think, you know, like I say, looking back, there's perhaps different smaller things that we could have changed, you know, producing sort of more of the audit data and the safety information, which is what really a lot of teams sort of ask about. But that was quite quite difficult at the time when we were changing the service. So I think generally on the whole, you know, it worked well for what was needed, and it's going to continue to work well alongside all of the other work that we provide as well.
Perfect.
Yeah, I agree with Nikki in that we've got an awful lot right in terms of the delivery for cardiac rehab during the pandemic. I think COVID has given us the ability to mobilise very rapidly and to try different things, and almost give us permission that it doesn't have to be the finished article straight away in terms of having that urgent service delivery. I guess if you were looking to roll it out now, I would probably say to invest some time in terms of staff training, because as much as technology can be new to our patient groups, some of the platforms that we've been using can also be very new to our staff groups. And with the situation that we were in, staff had to adapt very quickly and use those platforms directly for patient benefit and for patient consultations. And it may be a better approach to be able to use that within your team and for staff to get more confident with it, with MDT meetings and training before having that more pressured situation of patient care. And I think from my point of view, as Nikki was saying there, in terms of wanting to stick with these approaches, and I think a lot of that comes from that business continuity planning, and I think that is something that you need to factor in when you're making changes to your service delivery. And I guess I'm quite conscious that a lot of what we've implemented here are off the back of pilot projects and small pots of commissioning money, in terms of some of the devices that we've been able to use, some of the equipment we've been able to give to patients. And I think actually looking at the model for business continuity is something that definitely we will be looking at in coming months, to ensure that all the huge amount of work that's gone into making these changes can actually result in lasting changes for our patients as well.
Thank you, Sonya.
I think I'm going to focus my answer mostly, I think, from a student perspective. And the first is what I haven't mentioned. So I've initially got involved with CardMedic as part of an elective module through university, which was a 6-week placement, that's developed into the internship. I think most medical students tend to go abroad for their electives, which of course can be a really exciting, great learning and life experience. And I was initially meant to be going to Barbados pre-COVID, and that would have been great. But I wouldn't change this for the world. I've learned so many new skills from kind of being involved in such an innovative project. I've done a lot of things outside of my comfort zone, which were all, as I've mentioned, a bit frightening at first, but my confidence has improved a lot, which is a nice feeling, with a nice kind of bag of new skills to be qualifying this year with. And I think my second point would be just aimed at all students, which is I wish I'd kind of known in my earlier years, which is just to be confident in approaching seniors about their projects and your interests. Like, we're young and enthusiastic, and most people are kind of keen to have students help them out and to get involved. And being at university is just the perfect time to gain that confidence in areas where you're lacking. And there's lots of opportunities out there to do that.
Brilliant. Thank you, Scarlett.
Yeah, so I would probably have gone back and done a bit more of just approaching random people that I'm interested in working with, and just telling them about all the things that I want to do, and then getting them on board and co-developing, co-designing new services together, or just getting their input. And I think one thing that is becoming very apparent, more so as I get older, is that a lot of people like to talk and talk about themselves. And you know, if you give people the opportunity, or ask people to kind of help you based on their experience, people are generally quite decent and they'll do it. So I think I wish I am doing it now, but I think if I could go back and tell myself, whether it's for career development or kind of the projects and programs that I'm trying to deliver, or just advice and guidance in general, I would probably be a lot more outgoing and reach out to a whole bunch of different partners, and those would be individuals, organizations. And the other thing that I would probably emphasize is you know, for everybody, kind of just like reach out to some of the national bodies that we've got in the NHS, and you know, tell them about some things that you're doing and that you'd like to do, and sometimes they might be better placed to point you in the direction of someone that's done something that you're about to embark on. And if they don't have that information to hand, they might want to co-design something with you. So always a worthwhile endeavor.
That's wonderful. So that's the end of this section's questions, actually, and I think it's just been so worthwhile to have this conversation and have it out there for people to listen to and understand the experiences of what it takes to share, and that have the confidence in yourself to do it is really the remit, and know that what you're doing is worthwhile. As we've said, that we've got some links that's gone into the chat. So we've got Anu's story, we've got Scarlett's from Card Medic, and we've got Nicola's from the cardiac rehab team. And I'd just like you to go and have a little look at those and see the worth really from them. But I just want to thank all our speakers today for their time. It's been so worthwhile for me, and I hope it has for our audience.